I've caught a baby on the toilet because she squatted really hard and her water. Yeah.
Oh, wow.
Oh, yeah. Yeah, I will never forget it. I had no gloves on, too. That's the whole thing.
Hey guys, welcome to Nurse Talk, the podcast where we talk all things nursing. I'm your host, Mia, and today we have Max.
I'm so excited. I'm ready to yap. I'm ready to talk. Let's do it.
Let's do it. So I always like to start with, what made you want to be a nurse?
It's pretty interesting. So I first went to college not knowing what I kind of wanted to do. I knew I wanted to work in healthcare. It wasn't so much like, oh, I specifically wanted to be a nurse. I was like, I just want to help people and I like science a lot. So I started originally as pre-med, and I had gone through like my first semester of college and had talked to a lot of different people, like professors and also my advisor, and have just done a lot of research online. And I was thinking to myself, well, also YouTube vlogs of like a day in the life of a doctor. So I used to do that, and I was that kid.
Yeah.
And then I kind of realized that the amount of direct patient care you get is not as much as you would get as a nurse, if that makes sense.
Absolutely.
So I feel like I switched to pre-nursing my second semester, and I was like, you can always finish nursing school and then decide to go to medical school afterwards. It's a lot harder to do pre-med and go to medical school and then halfway through medical school be like, I don't want to do this. I want to be a nurse instead. So I was like, you know what? We can always take this other route. So I got into nursing school, thank God. And then I ended up loving it. Like, I loved the classes. I loved the people were amazing. The direct patient care, the specialty, which we'll get into later. But I fell in love with it, and I fell in love with what we do. And I don't know, it's kind of a little special world where it's like only nurses get each other in a certain way.
Yeah.
And I love it. It's like, it's so good to be, it feels good to be good with patients.
Oh,
and
absolutely.
I think that, you know, it feels like it's just very rewarding in general, the whole thing.
When you have a good day and you are like on your P's and Q's and people are like, oh my God, you're so great. You're like flying high, you know? Like
I'm like, oh, thank you so much. Like, please tell me this more again. Yeah. Because this is not every day, I'll tell you.
But the bad days are equally as
And there are bad days, but I think, you know, you have to look at it, the bigger picture in general, and see. I have a lot more good days than I do bad days. So it's okay to have those bad moments.
Oh, absolutely.
Yeah.
Did you always know you wanted to do like women's and children, or?
So it was a funny story. So that was actually I did not want to go into that at all.
Really?
Yeah, I know. And now look at me and I'm here. So, okay, so let's talk about it. So when I got into nursing school, I was pretty much open to any specialty. I was like, whatever, you know, I have no idea. First of all, I had no idea what I was doing. I was extremely doe-eyed. No real experience in the hospital other than like shadowing a physician when I was in high school, which I don't count that. So I started off in med search with the clinicals, and I didn't love it, but I didn't dislike it either. So it was kind of like the middle ground for me. And then I went into peds, and peds was, I did not want to do peds. No.
What was it about peds?
I'm not very good with kids. So I think I'm great with kids when they're good. When kids are sick and not well, it's hard. And then I think especially, pretty sure you relate to this too. When kids go through really horrible things, it's like devastating. Yeah. And I can't do that at work. Like I can't, not that I can't deal with it, but I don't want that to be my norm, if that makes sense.
Oh, absolutely. Yeah.
And then I went through like psychiatry, which no. And then and then I remember coloring with a patient, and he said some very colorful things to me. I'll leave it at that.
Oh my God.
And I was like, yeah, we're not doing this anymore.
Same.
Oh yeah, it's, you know, it's great for certain people. For me, no. So then I was starting to panic because I was like, oh God, like there's nothing I'm into. And I was like, am I just going to do med search? Not that med search is bad, but I was like, I don't know, like this whole specialty thing, like I really wanted to start off in a specialty. Then I was in ICU. I didn't love ICU either. And
Just
so I
like
was
general adult ICU?
yeah, like medical ICU.
Yeah.
I did medical ICU, and then I had a day in surgical step down ICU. And it was really cool to see what the patients had gone through to end up in ICU, but I didn't really love the tediousness of being an ICU nurse. I'm very type B. I was very
Okay.
like, yeah, I'm very much like an adrenaline junkie. Love to just do things more than like think about what I'm doing. Not that I don't think as a nurse, but you know, I love the adrenaline and being quick and accurate with like skills and being able to intervene immediately and kind of see immediate results.
Yeah.
So for me, with all of those things lined up, it was basically like, well, the ER is probably what I'll be into because it's adrenaline driven. You have tons of like, you know, crazy experiences happen there. And so I asked to do a day in the ER and I did, and I hated it. It was really bad. And I remember specifically, I was like, everyone's really mean to me and no one wants to be here.
Oh, yeah.
And everyone's screaming and they're, you know, pooping on the floor. They're throwing things at you. I was like, okay, this is
hell.
I was like, this is not it. So then the last one I remember was L&D. And I was like, what are the odds that I'm going to go into this and like it? And I was like, I had no interest in birth. I had no interest in any of those things. I was like, women's health, like how is a guy gonna at all be into women's health, right? And I specifically remember it was my first clinical day. I walked in through those labor doors and I sat down with my nurse and I heard screaming like down the hallway and I was like, oh, someone's giving birth. Wow, crazy. And then all the nurses got up and looked down like the hallway and there's a woman who is walking down this hallway and the head is sticking out.
Oh no.
And someone, I'm not joking, someone sprints over and is like ducked under this woman, ready to catch this head. And I remember that was my first birth I'd ever seen.
Oh my God.
Yeah. It was my first birth I'd ever seen. And I was like, this is the coolest thing ever. And then, you know, they rushed them into a room.
Yeah.
And then, not to bore anyone with the details, but basically she had a massive hemorrhage afterwards. And it was so cool to see like 10 nurses, 3 doctors, 2 midwives all in the room. First of all, she also didn't speak English. One's translating, one's explaining to them what they're giving, one is checking her bleeding, one is getting a second IV in her, one's trying to hang blood. Like, it was a whole thing. And I was like, this is so cool. Like, this is the coolest thing I've ever seen. So, and then immediately after that, our own patient that we were actually taking care of, because that was not our patient, ended up progressing really quickly. Like 4th time mamacita, natural delivery. Her water broke and it was game over. So her water broke, and then I remember the midwife came in and was like, oh, we have a student today. And I just kind of looked at her and I was like, please don't make me do anything. And she goes, I want you to put on some gloves. And I was like, okay. So I grabbed the little large gloves. And of course, when you're nervous and you're sweating, it takes 5 years to put gloves on. So I'm trying to put this glove on. And she goes, oh, I meant sterile gloves. And I need you to hurry up.
What are you about to do?
I literally was like, oh God, what am I doing here? So I was thinking I was going to be holding a leg at this point. And my nurse is like, she's going to have you catch the baby. And I was like,
No.
So,
Oh no.
little me, you know, 19-year-old me is standing there looking at this head descending. And I'm like, I'm not qualified to do this at all. But the midwife had her hands on my hands and I delivered the baby.
Aww.
And I got the placenta. And it's funny because after that experience, I was like, this is it. Like, this is what I want to do. And I not only became an L&D nurse right out of college as a new grad, but I'm going to be a student nurse midwife next year. So,
oh my God. Yay.
So now, see, experiences happen for a reason, guys. So, yeah, that's kind of like the long-winded answer as to like why I specifically went into L&D. But I love it. I have no regrets. It's the best field ever.
Yeah, I have seen a few births, and one just really freaked me out. And it was because her cervix was coming out of her body.
Oh no.
The baby was, out, but then they're trying to get the placenta and her cervix is literally outside of her body. And I'm like, is this normal? Like, I'm like whispering to the doctor and she's like,
No.
no. I was like, this looks
No.
bad. And she's like,
Yeah.
oh, this is going to be a hot mess after. And I was like, just the disgusting like feeling I got of like, because
Yeah.
when you imagine, you're like, oh my God, that could be me one day. My cervix just like pops out. Like, you feel it. You're like, oh my God.
Yeah, that's kind of the silver lining in this whole thing is I never have to go through anything that I see these women go through. And I tell myself that all the time. I'm like, yeah, this is a great day to not be a woman. Envious, but also thankful that I don't have to ever go through that.
Has your respect for women like dramatically increased?
Oh, yeah, absolutely. And like, not that I didn't respect women
Yeah,
before,
of course.
but no, it's just, it is a miracle. Like, it's literally the coolest thing ever that you can literally make another human being in you and bring it to life. Like, we have like nothing cool about us. Like, we really don't. Like, the man doesn't really have to do anything except be there for her. Which
know.
even sometimes that's difficult to see, which is crazy.
So I did see a few births, and what really pissed me off was how the men would be like across the room, like on their phone, like just chilling.
We're gonna get into birth stories. I have so many.
Okay, so that's my next question. So
Yes.
you can just go right ahead.
Let's just segue into this, I guess, guys. One of the happiest birth stories I have is actually from a nurse. So a nurse delivered, and it's actually not to brag or anything, but I did get a Daisy Award from this. So
yay.
I did. So, and she was just an induction. She had gestational hypertension, which is in the clinic. She had mild range blood pressures twice. And so they said, hey, you have to come in at 37 or 38 weeks. And we need to induce you. And it's her first baby. So, and she didn't want to be induced, but she was like, you know what? Like, if it's for the safety of the kid, like, let's just do it.
Yeah.
So she comes in, and I only had her for a very early labor, but I remember specifically, I just sat down, I pulled up a chair and sat down and just talked to her about her options. What do you want from this experience? What can we provide for this experience for you? Because at the end of the day, when you're induced, there's some level of control that the patient doesn't get anymore. And so I try to give the control back to the patient as much as I can. So I asked her, what medications do you want? When do you want your epidural? Because she was interested in an epidural.
Yeah.
And, did the whole thing, clocked out at 7 p.m. And when I left, she was probably like 2 to 3 centimeters, which it takes that long. When you're a first-time mom, like it takes a while. For those of you watching, it takes a while. So we then come back the next day. She had requested me, which that usually doesn't happen, but she had asked for me back. And so I had her. And she was 9 centimeters, and it was great. But she had something called choreo, like chorioamnitis. So it's basically when the inner lining of her uterus gets sick. And so now she's got this really high fever. Her baby's heart rate is tachycardic. She's tachycardic. Like, she doesn't look good.
Yeah.
But because she's so close, they're like, we can still do this vaginal delivery. Like, we don't have to go back for a C-section. So she pushes with me. She's a phenomenal pusher. Pushes in 30 minutes, baby's out. And I literally see a fire hydrant of blood just like start pouring out of her.
Oh no.
Which is pretty common if she had a couple things. So like her high blood pressure, she was induced forever. She was on Pitocin, like an induction agent, for hours. She had choreo, and it was a big baby. It was, I think, like 9 pounds.
Oh my God.
Just a lot of things.
This poor lady.
Poor lady, I know. And this poor kid comes out screaming like nothing happened. And of course, she's, like in shambles. So, I look at her and she just looks really sick. And at the time, I had never had a patient who was that sick in L&D. I'm giving her tons of fluids. I'm trying to get her fever down. I'm giving her antibiotics, Tylenol, ibuprofen, everything around the clock. And then the resident tells me to draw a gray top, like a lactic acid, and it comes back scary high, like very, very high. And so now she's septic. And I'd never had a septic patient before, never drew blood cultures before in my life. This is like month 1 of me being off orientation. Yeah. So I was like, this is a great assignment. I was like, no, literally. I have so many nurses that I could give a shout out to, but one nurse got me a hemorrhage cart.
You can shout them out if you want.
Oh my goodness, Monica Bento, thank you so much. And Jennifer Martin.
Yes, girl.
You saved my life that day. So then, literally, they're there with me side by side. They are Owen, Melissa McCartney. Thank you so much. I drew blood cultures. I'd never done that before. Never had a septic patient taking Q30 Thames, and I'm still doing funnels on her, and she's still bleeding out. And the long story short is that I ended up not charting anything the whole day because I was so caught up in this patient. And I just remember going home and I just felt awful. Like, I was like, I did so bad. Like, she ended up stabilizing and she ended up being able to go to postpartum, but they were talking about hanging blood, sending her to ICU because her pressure never came back up. It was a whole thing. But finally, she delivered with me at 7:30. And I didn't send her out until 4 p.m. And so for the last 3 hours, I was pulled aside and told that I should have been asking for more help and that I wasn't doing the best job that I could have done. And then I just remember going home and I just like sobbed in the car. And I was like, I don't know if I can do this. Like, this is really difficult and
and scary.
And it was just, I just didn't feel good.
Yeah.
And I was like, why can't I just get a normal delivery? I was like, all my other friends who are off of orientation, they're having normal days. I'm never having a normal day. And then a month later, my floor announces that there's a Daisy Award. And I was like, oh, well, cool. We'll just go to that. So I was like, and there's all these like senior nurses who are like, you know, extremely well loved by all their patients. And they do so much work and I look up to them. And I remember the organization, they were reading out this note that this patient wrote, and they didn't mention any she's or hers or anything. They just said this nurse did blah blah blah. And in my head I was like, there's no way. So I literally distinctly remember I was all the way in the back of the hallway. I was on my phone and I texted one of my coworkers and I was like, oh, we're doing a Daisy Award winner. And she's like, oh, who do you think it will be? And I was like, I think it's going to be this nurse who's been here for like 30 years. And she's never gotten a Daisy, but she deserves it. And then they mentioned my name and I literally cried. And I read the story and it was from that patient.
Oh,
the
how
one
sweet.
where they were saying, oh, well, you didn't do a good job. And she ended up writing me this whole letter. I have it framed on my wall.
Oh, I would too.
Oh, yeah. And it was just amazing. And then it brought back to me, you know, there's a reason you do everything that you do.
Oh, absolutely.
And it was...
I got little chills.
No. It was so... Because I felt horrible and I felt that I didn't do a good job that day. And then when I got that, I was like, okay.
I did do great.
I did do good. And I can do better, but I didn't
I mean, come on. It was
fail.
your first time.
I mean, I know. I'm really hard on myself.
Yeah, it's just a lot. Like when your patient gets like a workup and you have to do all these things, there's only so many things that you can do as one person.
I'm relieved that it's over and I know what to do when someone is sent
Yeah, you're like, I got this now.
I got this, guys. Give me the blood culture tubes. You're fine. But yeah.
Well, congratulations on being the Daisy Award winner. I would definitely frame that too.
I have it just hanging on my wall, but the note I have framed on my wall. So yeah.
So this story actually goes into my next question.
Oh yeah.
What role does teamwork play in the delivery room?
Ooh, anyone who wants to work in a team all the time, L&D is for you. I never felt unsupported ever in any delivery, in any sort of intense situation ever. There's always people there. We have pod buddies, so basically it's kind of like L&D is like one long hallway essentially, and then you have like 3 nurses stationed. So you have one for like the setup room, one in the middle, and the one at the very end. And your pod buddies are just like other nurses, kind of like in NICU, like you have your rows, like you have the other nurses in your row. Anytime a baby is like having a deceleration or someone's delivering, there's people going in the room just willingly. And I think that that's something that says a lot about the staff. The staff is like family. They are very like, anyone will go into your room. Someone's decelling. Okay, 5 people are in your room already. I'll be like, oh, can I get some help in this room? And literally there's already like a doctor and a midwife and like 3 nurses. And they're all like flipping, finding heart tones. Like one's charting everything. One's stopping my pit. Like it is really all about teamwork. Because as the saying goes, it does take a village to do a delivery. And it's true. Like it does. Like it's a very, very primal, but very, very like there's a lot to do very quickly. So sometimes you need help. And so I think sometimes when you're like when you have like 6 patients or something, like it's so difficult to ask to have help, like a lot of help really regularly. But I think especially in L&D, because most of the times you're one-to-one and there's like 20 nurses on the floor, like anyone's down to help.
That's amazing.
Yeah.
So you're usually 1-to-1, or is it like maybe 1-to-2?
Sometimes it's 1-to-2. It's usually they try their best to keep you 1-to-1. Sometimes if you have 2 early labors, you can have 2. If you're postpartum. So L&D, I also did not know this. We take all the unstable postpartum patients and the unstable antepartum patients if they can't go on like a normal antepartum or postpartum floor. Because on a normal antepartum postpartum floor, it's 1-to-4.
Oh, wow. Okay.
Yeah. So if they can't give the care that they need, they come to our side. But yeah, like if you have someone who's like 5 centimeters, it's probably going to be 1-to-1 always. So yeah.
That's good, because you're most likely going to deliver on that.
Yes.
Yeah.
Yes. And things can change very quickly. And people know it. Like you might have someone who's 2 centimeters, but if it's her 5th kid, don't.
Buy lunch. No.
Yeah. Don't give them another patient. You know what's going to happen. So, yeah.
So how would you describe the overall like morale and culture in the L&D kind of universe?
We're kind of chaotic in the best way possible. We all actually just did a group berries class together.
Oh, I love
for
that.
fun. Yeah. Everyone is super like, I don't know, high energy. Pretty much almost everyone I work with is an extrovert. And everyone is super, super friendly. Like I would say that the morale is really good in
That's
general.
awesome.
Yeah. And in labor and delivery, you kind of have to have really good morale. Because L&D asks a lot out of you, so you have to put a lot into it. So I think the other thing with labor and delivery is a lot of people who do labor and delivery love it. There's this saying where it's like once you're in L&D, you never leave, and it's kind of true. Like I don't think anyone would ever really. I can't imagine any of my nursing colleagues who are in L&D switch to a different specialty. Like I really
It's
can't.
crazy because I feel like L&D is the only one that's like that. Like even in the NICU, some people are like, oh, I don't want to work here anymore. Like this is, and then everyone that I talk to that works in L&D is like, I don't want a different job. This is my job.
I don't want a different job. Like I think it's just because women's health is so niche. It's so unbelievably specialized. Like nothing you learn in nursing school from any of your other classes other than your tiny little OB block applies. Like it's so different. And obstetrics is a whole field, and then gynecology is this whole other field. But I think it's just because once you get it and you understand it, which I think is one of the big reasons why people don't like it at first, is because it's so different and so hard to get. Because I mean, it's a tough class and it's a tough clinical to get through. But once you get it, like you're hooked. But if you ask me anything about any other field, I'm clueless. Cardiology, don't ask me anything. GI, helpless.
Yeah.
I can give you Miralax. Like that's the best I can do.
Do you still cry on every birth?
Oh, I would say in the beginning I did. I cried at my first delivery.
Yeah.
I did. A newborn's first cry is a magical sound.
Oh, it is.
Like
you're like, okay, thank you, God.
Oh yeah, no, literally, it's the most amazing thing to hear. I think now I don't, not because I'm like desensitized to it, but I think it's just because I can admire how incredible it is without letting my emotions kind of like work me up.
Okay.
I think in the best way possible, I've had a couple really bad deliveries, and I think that has sort of shaped my realm a little bit, that I don't cry because I'm like, oh, it's this beautiful, magical thing ever. Not that it's not beautiful and magical. It is.
Yeah.
But when you work at a high-risk facility and almost every other delivery is like something's going on, it can shake you up a little bit first. But I had a nurse deliver. Like I had an ICU nurse who delivered with me, and I like sobbed fully.
Aww.
Oh yeah.
Yeah.
Because they were sobbing and then I was sobbing. And especially when the dads start crying, that's when I lose it. Like I can't do it.
I've seen like 10 births, and even on the 10th one, I was like, oh,
Oh yeah.
I was like, I don't even know these people.
But it's just so cool. Like, it's never boring to suddenly have a new human being just present. Like, it's never like
He's just
not
there.
boring. And I think that's the best way to put it, is that L&D nurses, like, we like going into work, and we like kind of being like, okay, what's going to happen today? Like, that's the best feeling ever, is that when you love your coworkers and you love what you do, like, that's why no one in L&D really leaves, because we just love what we do. And it's I don't know, it's just the best. I'm trying to convince everyone to go to it. It's the best.
Do you feel emotional leaving your coworkers?
They're watching this, so
Say yes then.
so yeah, no, okay, really, yes. That's actually the thing that is going to be the hardest thing for me, is the coworkers that I have worked with and grown with have been like a lifeline for me. And I think it wasn't always like that. When I first started, it was still a little bit tougher. I've always had fans from day one, but especially being a guy in the field, it's a pretty, and I was the first guy in a while, like a number of years. I remember specifically, this nurse doesn't work there anymore, but she made every move towards me to try and get rid of me. And
What a
I was like, oh my gosh, literally hated my guts.
Just because you were male?
Hated. Oh yeah. She was like, it's not appropriate that he's here. And I was like, well, I'm here to learn, and I'm here to, like, I have no intentions. First of all, I don't know if anyone's watching this podcast and is questioning things. I have no intentions towards that field. Let's talk about that.
What advice would you give other men considering getting into L&D?
This is for any male nursing student, any guy who wants to go into L&D, is you can do it. Okay?
Absolutely.
The amount of times I used to go into the room and kind of ask them, like, are you, like, comfortable if, like, you have me as a nurse? No, I don't do it. I haven't done it for, like, months and months. And I think it's just because, one is 99.9% of the patients I get don't care. And the other 0.1% who do care, like, as I literally take 2 steps into the patient room, they'll just be like, hey, just so you know, like, if it's fine with you, I'd prefer to have a female nurse. I was like, that's fine. Good luck. Yeah. Have a great day. Like, I wish you all the best. And literally, it just is like that. And it's never like, I almost feel like I got more backlash from nurses than I did from patients, which is really crazy.
Because I would not anticipate that.
But also, I think, there's male OB-GYNs, there's male surgeons, there's male scrub techs, there's male newborn nurses, there's male nurses in the NICU. There's guys everywhere, okay? And they all love what they do, and that's why they're there.
And they are such an important part.
Honestly, it's the same with any clinical. Go in with as much of an open mind as you can. You might get turned away. You might, people might have a hard time with you being a student, but any patient will have a hard time with a student. A lot of men sometimes feel like, respectful men will feel like they're invading, like, privacy very much.
Especially if you're doing, like, a cervical check.
Exactly, yes. So if you're not comfortable seeing a vaginal delivery, go see a C-section. Like, a C-section is great.
God, how do you...
Well, I think seeing a C-section is a great learning experience.
Yes.
It's brutal.
Yeah.
It's a brutal surgery. And I think as someone who works the other end of the drape, it's a lot to see sometimes.
Yeah. I almost passed out when I saw one. Like, literally, like, they stood up, both people on each side, stood on their stools, and they said, you ready? And they both grabbed on, and they just started tugging.
Yeah.
And I literally, like, I could feel, like, my legs, like, my knees were going out, and I was like, oh. It's different, I guess, when like, one day you might have to endure. And I'm like, no, this is horrible.
Yeah.
No.
But yeah, I definitely think, any guy can do, just like any woman can do it, any guy can do that. But circling back, definitely the coworkers now, That nurse left, and honestly, there was another nurse who also left, which thank goodness she left. After that, it's honestly like blossomed. Like the relationship that I've had with the nurses has been nothing but growing. And I've met some of the closest friends that I've had till this day there. It's just the best. Like it's going to be so hard leaving. It'll be very difficult. I don't want to think about it too much.
Yeah, don't cry.
But yeah.
Okay, so what are some myths you'd like to debunk about L&D?
Oh, I have so many.
Okay, let's do it.
I have so many myths. I think a myth that people have about being an L&D nurse is that we're really stuck up. I think that that's something that people have said. Not every student or person shadowing is really interested in the field.
Yeah.
And so sometimes when that happens, that's when the nurses can kind of get stuck up because it's like they've been doing this for 20 years and it's like, how on earth are you not interested in this? Like, what do you mean? Like, you know, it's more coming from that than it's like we're just stuck up because we're stuck up. You'll be wiping butts still. You will still be doing that. It's a lot more critical thinking than you think it is. There's a lot of like, okay, well, what can you do here? What meds have we not given? What positions have we tried? Have you tried a fluid bolus? Like all these things. You'll get very good at IVs because you have to pretty much put one in everyone. A general myth I have about labor for anyone watching is it will take a lot longer than you think. A lot of patients will come in and they always ask me, the number one question I get is, besides how much does the baby weigh right when the baby comes out, which I'm like, girl, your guess is as good as mine. I don't know. Like it looks like it's 7 pounds.
Yeah.
And then it's like 8.5. I'm like, oh, well, okay, well, whatever. The question I get asked the most is, how long do you think this is going to take? TikTok and Instagram and Facebook Reels. I don't even know if it's called Reels, but
Yeah.
I'm Gen Z, sorry. And like YouTube birth vlogs, like it's all edited short forms of content and it's not medical information that they're providing all the time. So, especially if it's your first birth and you're most of the times with your first birth, unless your water breaks or you start spontaneously contracting, you more than likely or not will be induced for some sort of medical reason. But if not, then, you know, you just go into labor. It can take days. And I mean days. Like it will, yeah, no, I've had patients for 3 days, 2 days, all the time. And it's kind of, I don't want to say that that's the expectation, but I always tell people, get comfortable, bring pillows, bring your own blanket, bring your own snacks and your own drinks that you want because you're going to be here for a while.
Bring your iPad to watch movies.
And chargers, bring a fan and a white noise machine.
1, 2, 3, rapid fire. What are some more myths that people should know?
And okay, let's do it. So 1, if you have a birth plan, it's probably not going to go very well. That's the first thing.
Yeah.
Labor is all about going with the flow. So if you have a birth plan, it's probably not going to go very well. Getting your epidural doesn't hurt as much as you think it does. We do not care if you want to breast or bottle feed. We will always educate that, you know, breastfeeding provides more benefits than bottle feeding. But if you don't want to do it, girl,
don't do it.
Don't do it. The nitrous oxide does not do anything for physical pain. Please don't plan on using it if you are trying to get rid of physical pain. It's more of like a mental thing. It's more of like a distraction. If you get an epidural, no nurse thinks that you're weak. That's another thing. Like no one does. Okay, it hurts.
Yeah.
You have a 9-pound watermelon trying to come out of there. Like it's gonna hurt. So that's another thing. Labor hurts. So if you are natural and you come up to me and you go, my contractions hurt. Okay, well, can I give you anything? No.
What do you want me to do?
I will offer you a nice cup of orange juice and a heat pack, and I will skedaddle my way out of the room. You don't always have to push on your back. That's another thing. I feel like people always are like, do I have to push like in the I'm like, no, you don't. You can push however you want. Now, technically, it's most effective and the easiest way to push is on your back. But if you're uncomfortable with it, don't do it. Do what's comfortable for you.
So even in a hospital setting, if someone wants to, I have never seen anyone give birth any other way. But I've only seen.
I've caught a baby on the toilet because she squatted really hard and her water. Yeah.
Oh, wow.
Oh, yeah. Yeah, I will never forget it. But yeah, Her water broke and she was squatting and the head just came out. I had no gloves on too. That's the whole thing. We weigh the baby unless if it's medically necessary an hour after they're born. So I don't want you to ask me anymore when the baby comes out. How much does the baby weigh? Like, how big is it? I'm like,
It's literally been on you the entire time.
I know. Where's the baby gone? Like, do you see a scale here? Because I don't see a scale here. We break your water a lot more often than you think. A lot of people are like, is my water not supposed to break? I want to see like a good 60 to 70% of the patients I have, we break your water for you. And it doesn't hurt. It doesn't hurt to break your water. It literally, they use like, it looks like a crochet hook. And they
Yes,
poke
I've seen
the bag.
that. Yeah.
Or they'll like skid it a little bit to like make a little tear. I wish you could labor in bed, just lying down,
Yeah.
doing nothing. Occasionally, maybe you flip to your side. Labor is active, especially when you're actively contracting and you're in labor. Maybe not active labor, but when you're in labor, movement is key. There's lots of positions we're going to do. There's a lot of movement, so expect to move.
Yeah.
I've had so many patients where they're like, I don't want to move. I'm like, okay, well, your baby hates you being on your back right now. And you haven't moved in 3 hours. Like,
Yeah.
let's do something. So participate in your birth. Like, that's a big thing, I feel like. Oh, when your water breaks that you're on the clock. That's a big one.
Yeah.
The two rules that we have is as long as you are okay and as long as your baby's okay, we can keep going. Now, you being okay is, do you have a fever? Are you tachycardic? Are you making progress? Do you feel like you want to keep going? Are they tolerating labor? Do they have good variability? Like, these are all things that we look at. If those two things are thumbs up, girl, you can keep going. People have had their water broken for days and they can keep going. I've had patients get choreo with their water intact. So like literally anything can happen in labor. Always go with the flow. I will re-emphasize that again because you do not dictate what happens with your labor. Your baby's going to do it.
Yeah.
And you can't tell the kiddo, I mean, you can try, but you can't really tell the kiddo what to do. So there's been a lot of hard moments I've had with patients where it's like, I know that you didn't want this, but your baby is telling us other things. And when you're an L&D nurse, you're taking care of the patient, but also the baby.
Yeah.
So you have to advocate for the baby because the baby can't, say what they want or what they don't want, but the mom can. So it's hard sometimes in that.
In movies and TV shows and stuff, it's always like, oh, my water broke. Now I'm in labor. You can be in labor and your water not break.
Oh, yeah. And you can also have your water break and not be in labor.
Yes.
I will tell the people this right now. Labor, by definition, is that as long as you are having consistent contractions where you have cervical change, you are in labor.
Yes.
If you are not having any, girl, if you're 0 centimeters and you're contracting, you are not in labor. Go home, do some squats, have some pineapple juice, eat some dates, or what else is there? Like raspberry leaf tea. That's another thing that people do. I don't know if any of those things work.
I will say, is that another myth? But I guess.
Oh, that like you can have like raspberry leaf tea to put you in labor. I mean, I've never had raspberry leaf tea and I've never been in labor, so I'm not the person to ask about that. I guess last thing is it's never too late to get your epidural. And it's never too early to get your epidural. Epidurals are wonderful things, okay? We literally created modern medicine so that you don't have to suffer. And I have so many patients who are like, I want to see how far I can go without getting the epidural. And I'm like, that's fine with me. I promise you, when you're going to get that thing, you will be like, why have I not done this earlier? I've never had a patient say, I regret getting an epidural.
Really? A lot of times are they kind of against it?
I don't think that they're against it. I think it's that the trend. But I guess the trend now is that, we want you to have a natural birth. And I've had some really strange birthing experiences. I had a lady play on her phone once, this like doula live stream of her being like, I want you to close your eyes and think about your cervix opening. And I'm not joking, for 12 hours.
Oh my God.
And she refused any intervention. And when I started my shift, she was 2. and she ended my shift at 2.
Oh.
And I was going to tell her, like, girl, this is not a good idea. And she was so uncomfortable the whole time. But no, I think it's more like the trend nowadays is that they want to go as natural as possible, and that it's almost like patients are against medical interventions. Like they think that the hospital is just the place where you give birth, which in my opinion, if you don't want any medical interventions, you can have a home birth. There's
Literally.
nothing wrong with that. Yeah. Have a home birth. Be in the comfort of your home on your bed.
Literally.
You know, don't come into a hospital bed and like suffer and then be offended when people come up to you and they're like, do you want to sign this consent form for, you know, like a pelvic exam? I don't want to be checked. Girl, why are you here?
Literally, why?
Why are you here?
Why?
You know, so tying in with that is also the epidural. I think a lot of people have tons of misconceptions about it, but the only limitations that you have with an epidural is you can't walk, which is like, you know, please don't walk. I've had someone standing with an epidural before and I freaked out.
Yeah.
And you can't go to the bathroom, but we fixed that. We give you a catheter and then we take it out right before you start pushing. So it's like you never had it. But yeah, I've never had a patient say, I regret getting my epidural.
I think the only thing I've heard is that, like, you know, for some reason or another, they have back pain after. Like it.
Yes. So I actually do want to address that. I think it is CRNA or anesthesiologist dependent.
Okay.
And I think it's mainly because, how do I put this lightly? Before we put an epidural needle in you, we give you local anesthesia so that you don't feel the needle going in, right? And it's lidocaine. And lidocaine, especially when it's like pretty surface level and they're moving a needle around and they're trying to, you know, numb up your back, sometimes not everyone's perfect. The needle can go places that it's not supposed to go. It can go deeper than it's supposed to go. They try many times to put the epidural in and it doesn't work. Like, and that's a lot of the times like things that can happen. It's not a perfect science, an epidural.
Yeah.
I feel like people need to see how one is placed to know like why it's not perfect, because it truly is like a work of art. Like when an anesthesiologist or mostly CRNAs do epidurals at my hospital, it's like artwork. Like they're so good and they're so specific. But I've had many of my coworkers who've had children say that their back was like, it felt weird afterwards, or like they had some back pain after they got their epidural. So you can always say no to a student.
Yeah, it seems like kind of, what's the word? Because I was a student. I sound like a hypocrite.
Oh yeah, no. I would never let a student do my epidural.
But like, yeah, like I've had students who like take my blood and blood ends up everywhere. And I'm okay with that. You got to learn. And I mean,
that's fine.
Whatever. But my epidural, I'm going to be like, no students.
Oh yeah, no. Almost every nurse that I have says no students for the epidural. No medical students or like midwife students delivering. They just want like, they're like, please, I don't want to risk anything. They're like, they can be in the room, but they don't want them doing it.
That was my baby. No.
Yeah, no. No. Last myth I'll say is we will never tell you what to do. I'm never going to say you need an epidural. I will never say that. I will always say, I think an epidural will benefit you because you look excruciatingly uncomfortable, or you need to breastfeed. You need to turn on your side. I'm going to say, can you turn on your side, please? Your baby's heart rate is down. And that is how you tell people in L&D what to do. It is very fast paced. Things happen all the time. Things that you don't think are going to happen. We want what's best for you. But most importantly, we want the safest thing for the baby. That's the biggest thing. And I don't think when you're in labor, you're really thinking about that. But I've had plenty of patients tell me after their baby is born, they're like, I'm happy we did what we did. Or I'm happy you suggested this. Or thank you so much for being like a voice of reason for me. Because I've had plenty of births where it's like, they are really, 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 really stuck on having a vaginal delivery and it's just not working. Like the baby hates labor. It doesn't tolerate a single contraction. And I'm like, you're 4 centimeters, your water's broken, you're starting to spike a fever, your baby doesn't like labor. Like, we need to think. I want you to be reasonable. I want what's best for you. And I want you to have the experience that you're having. And I'm all for that. But your baby is not doing too hot. And I don't know how much longer your baby can keep up with it before it just gives up. Like, that's the big thing.
Yeah.
Because labor is stressful for the baby. So it's getting squished every 2 to 3 minutes and it's trying to fit through a 10 centimeter hole. Like, it's a lot for the kid. And when you're contracting, the baby's not breathing. Like, it contracts everything. So your baby has to basically get through the contraction by itself until your uterus relaxes, and then it's fine. So I feel like a lot of people don't understand that.
Yeah.
So I think just know that your nurses, 99% of them don't like the OR. I do not like the OR. Okay. I do not want to go back for a section, but if we have to go, we have to go. And we won't be light on suggesting that. It's more of like, these are the things that we've tried. This is what's happening. I think this is what is best. You can always say no, but I don't think it's the greatest idea. And almost every time the patient at the end does comply.
Okay, good.
And they're like, you know what? It's probably best for me.
Have you had someone who didn't comply and there was a bad outcome?
Yeah. Nothing devastating, but I had this patient who was toe lacking. This happens a lot. And I'm a very big toe lack advocate, which is basically a trial of labor after a cesarean. So they've had one C-section for whatever reason. And so they want to try and have a vaginal birth. And the biggest thing for us is, why did you have a C-section in the first place? Mm-hmm. If it's because, like, for instance, your baby was breech, for instance, like, you never really had a chance to labor, right? Yeah. My patient wanted to TOLAC because she was failure to progress. So the first time, she only got to 4 centimeters. So this time, she was told that she was going to be induced at 39 weeks, and she never showed up for her induction date. Nice. Yeah. Cute. So she comes in at 41 weeks and 3 days. So the clinic is calling this patient and is like, hey, you're 41 weeks today. We really, really would need you to go into the hospital. And she was like, nope, I'm not doing it. So what brought her in at 41 weeks and 3 days is that her water broke at home. Like, she'd been laboring for 3 days, basically. And she comes in, she's 3 centimeters already. Excellent. Love that. But you're also 3 days late. So because you're also late now, like, we do need to intervene. Like, your placenta is probably not doing too hot in there, because it's already 10 days old from your due date, which who even knows how accurate that is, because that's what she told us. And then your water is broken, so now your kiddo's not loving it, and your kiddo's probably also a little bit chunkier because you're more than 41 weeks. Yeah. So there's a lot of like going on right now, right? She didn't want an epidural, and we had told her that you know that's fine for laboring, that's okay, but in the event that you need to go back for a C-section, you'll be put to sleep. And because you are toe-lacking, you are at a higher risk for a C-section, to have like a repeat C-section. Mm-hmm. So because of that, we'd recommend you get an epidural, just so that if for some reason, we have to go back, then you can stay awake. And your husband can be there, and you can still do skin to skin, all that stuff. Because the first time she had a C-section, it was for a prolonged decel, and it was a stat. And she was put to sleep. And we were like, we really don't want that experience for you again, because I'm sure that was terrifying for him. She's like, I don't want that. And we're like, okay, it's fine. Her water's been broken now for like 12 hours at this point. So I take her temperature. It's fine. Baby looks okay. When your water's broken, we try not to do a cervical exam too much, because it can introduce infection, and you're putting your fingers. And so it's like, it's a whole thing. We do an exam on her, and she's still 3. And she's like uncomfortable, and she's contracting. So we were telling her like, hey, it's been 12 hours since your water broke. You're not really contracting that often. We would like to start you on Pitocin, because I think you just need more power to progress. And she's like, I don't want that. And I was like, okay, let me just tell you what's going on, basically. Yeah. I was like, so we need to expedite delivery. This baby's measuring big, like big. It was like, I think 4,400 grams. Nice. So I was like, oh, cute. It's great. So of course now internally I'm like, great, this is going to be like a shoulder, and she's going to be natural, and it's going to be a whole thing. Right. So she refused everything. At some point she refused monitoring, and we said, we can't do that. She's there. This is also like at like 8 a.m. when she's been 12 hours, her water's been broken. So 5 p.m. comes around, and she hasn't been checked in forever. She's been up and around, moving around and doing her thing, right? She finally feels the urge to push, right? So we go in and we check her. She's a lip rim. So she's like 9.5 centimeters, which we're like, great, you've passed your 4 centimeters. She was only 4 centimeters the first time and her baby acted up, right? So
Yeah.
two reasons why she got sectioned so quickly. We are like, okay, great, your lip rim, like you have, basically it's like she's complete, but she has like a tiny lip of cervix like up here. Like show the class for a reference. Instead of this, it's like that. So because it was anterior, we said, why don't you get on your hands and knees? Because then the baby's head can like push it and then it's good. It'll get rid of it. So I have her on hands and knees and she's like pushing with the contractions. And I said, I don't want you to push because your cervix is going to swell and there's a chance that it could tear because if it's not fully effaced and it's not fully gone, then we've got a problem and the head can just like rip it. So we don't want that. She's pushing. Don't do that, please. And so she's like, okay, well, I really need relief. I have to push. And so I was like, okay, let's get you an epidural. And she's like, okay, fine, I'll get it. So she gets it and she's finally comfortable. And honestly, just the ability for her to finally relax got her to 10. So I was like, okay, great. So now she's 10. We start pushing and the baby is tanking fully. Like the baby just looks horrible on the monitor. All of a sudden it's very minimal. So it's very flat, her baby's heart rate. And it's slowly creeping up the baseline. I'm like, oh God, she's getting choreo. So I take her temperature and she now has choreo. I tell her I'm going to give her antibiotics. And she first says no, but then I tell her why. And then she's like, okay. And I basically said the words, do you want to go back for another C-section? And she goes, no. And I said, okay, so then we need to do this. And she's like, okay. She's not the greatest pusher. Like she's not very good. So, no, not really. And like we're really coaching her. And literally you just see this heart rate, like as she's pushing, it just plummets and then it comes back up and then it just plummets again. And I was like, I think they're gonna call it. Like I think they're gonna say something to her because the baby was also only 0 station. So it was still kind of high up. Like you can't do an assistive vaginal delivery at that point. Like when you're +2, +3, like you can do a vacuum or forceps, which it's provider preference and they're both fine. They both have pros and cons. The baby was like miles up still. So we were like, okay, let's just push. And thank goodness this attending, bless her soul, was so patient with her and basically told her, I need you to get a grip and I need you to push well. So we're pushing. I think like 2 hours goes by. We've made very little progress, but this attending physician is so skilled at forceps deliveries that she was like, I will try and do a forceps delivery. And the patient's like, no. And we said, okay, well, the baby looks like garbage right now. You look like garbage. And we need to get this kid out like now. So she's ending up like, then she's like, oh, just let me try for like 10 more minutes. And we're like, okay, sure. As if 2 hours didn't do enough. And I don't know what spirit possessed her, but she pushed and all of a sudden you just saw, woo, like the head just came down. So she's like, okay, maybe we don't need forceps. 30 minutes goes by. It's still sitting in the exact same spot. So we're like, maybe we do need forceps. So we're telling her, she's like, no, I don't want it. And then she does the same thing again. And I'm like, I think she's playing with us. I don't know what's going on. So then she pushes really well and the baby comes out almost a shoulder. She was able to get the baby out. Smurf blue. Like the bluest baby I've seen ever. And it didn't cry for like 4 minutes, was immediately put on CPAP. Ended up in NICU. I think the APGARs were 1, 1, and 6.
Probably a cooling kid.
Yeah.
Yeah.
Baby went to NICU for cooling. And of course she's like, I want to do skin to skin. What's going on? And we're like, priority right now is we got to fix you. Her placenta came out. Oh my gosh. The amount of calcifications and like, it looked disgusting. Like it was covered in mech. It was like
probably starting to disintegrate at some point.
And she wanted to eat it. And I said, we're going to put this in the trash can. I literally said that. I was like, this belongs in the trash. This is not going to give you any nutritional.
She wanted to.
Oh, yeah. Oh, yeah.
Do you see that a lot where they want to eat it?
Yes. Oh, I have Lotus Births all the time. At a C-section Lotus birth, which I don't even know how that works, but it does.
Wait, what is a Lotus birth?
Oh, let's educate for the class. So a Lotus birth is when the cord is not cut. You do not cut the cord. The baby comes out and the placenta comes out, and they are still attached. And usually you put the placenta in a bucket next to the baby, and you put, I don't even know, it looks like oregano. You put spices in it.
Wait, hold on. You
I have to
actually
keep a
do
straight
this?
face because my coworkers are watching this. So they put spices, and it honestly looks like they're seasoning it. It does. And they leave it there. And they leave it until it turns white, which is usually like 5 minutes or 5 to 10 minutes, but they leave it there for hours. And that's it. And that's what a lotus birth is. And I don't think there's any research or
Is it
anything
just
on it.
is their
Some
idea
people-
behind it is like they're getting all the blood from the placenta before they
Yes,
detach?
but literally, there's this midwife I work with. Her name is Leslie. She's the best. She's been doing this for like 40 years. Okay. She doesn't play into any of that crap. Not that it's crap. She'll literally pick up the cord and be like, I want you to feel it. And she's like, it's not pulsating. Your kid's not getting anything. Cut it. Like, she'll just say it like that. And they'll do it. But, you know, we want to respect everyone's birth preferences. And so I don't know if you've heard of the new saying that birth is the new wedding, where they try to plan everything in their birth. So we have tried to shift away from saying a birth plan, and now we say that they have preferences. So
Yes.
if you have preferences, that's okay. Please have preferences. But, you know, don't be like my patient who came in at 41 and 3 and had a horrible delivery experience with a horrible outcome with the baby.
Didn't have to do all that.
No, she didn't. But some of them are really like I have a nurse who's toe locked before, and she was like, it was the best thing I did. But she was great at toe locking. That's the difference. If you're great at toe lock, if you're going to be a great toe locker, great. If you're not,
Just get the freaking
just get a repeat, girlfriend. You're doing no one's gonna care that you toe locked. Really, when
You think if it's like a badge of honor in a way? I feel like
yeah, I think it's an ego thing. Like, I think that patients will be like, I've had 3 natural deliveries. I'm like, how many people have Publix that you told that to? Like, I just, you know, especially someone who works in L&D, I could care less how you delivered. Literally do not care. Just, if you want a great baby and you want a great delivery, do whatever you want to do.
literally.
I literally don't care. Like, you've had 3 natural deliveries. Good for you.
Couldn't be me, I don't think. But
I've only had 1 natural delivery where she had it together and she didn't lose it and she didn't lose her cool. And it was the most mesmerizing thing I've ever seen. She was 17 and alone. And she didn't speak a lick of English. And she was the most phenomenal patient I've had. She
Really?
was open to everything. She just wanted to go natural. That was it. She came into triage, 6 centimeters with a bulging bag, completely unfazed. She was like, when she was contracting, she would just, okay. And I was like, this is unheard of. So bring her to a labor room. Her water breaks on me. Great. Immediately, I check her right afterwards. I'm like, she's complete. There's no way. So she's complete. Pushes for about 30 minutes. Doesn't scream. Doesn't make an ounce of noise. She's like fully in the zone and ready. Only at the very, 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 very end, like once when the head came out, she literally went like, ooh. And that was it. It was the most incredible thing I've seen in my life. That was the coolest and most incredible thing I've seen. And she was an absolute sweetheart. I think about her like
Respect
now.
to her because
Respect to her.
wow.
I could no.
I would be like,
No. See, she deserves that badge of honor. She needs a badge where she did that. No, but a lot of the times, like, I think people pride themselves in how they deliver. I'm like, girl, no one cares. You have your baby in your arms.
I know,
That's
it
all
literally
people
makes
care
no
about.
difference to
People
anyone.
ask you, oh my, like when they see a baby, like, you know, you're grocery shopping and you're like wheeling your little stroller down and they see your baby. They're like, oh my goodness, it's so cute. They'll be like, what's his name? Like, how old is she? Like, how are you sleeping? You know, like, how's the baby? How's your, you know, everything. They're never asking, how did you deliver her? Like, that's never a question people ask. And I think, I don't know what it is. People just feel the need that they have to have a status on something. And it's like,
for
oh my
sure.
God, give me a break, please.
I'm like terrified because on Voceras you can accidentally broadcast, and labor and delivery nurses always broadcast on
Oh yeah, we
accident.
do. So you'll
And
hear everything.
no, literally you're just like standing on the opposite unit, and all of a sudden your Vocera goes off. It's like, ah! And then it shuts off, and you're like, oh no.
Oh, it's a very vocal unit.
Oh my God, it's
But-
terrifying.
I mean, the screaming's part of it, but like, they're not screaming for no reason.
I mean, yeah, it looks horrible.
I've had patients tell me that they're horrified for the IV that I put in them. I'm like, honey, sit down. Like, let's take a seat. Do you know what's about to happen? This is a mild inconvenience that's occurring right now. The big picture is this bowling ball is about to come out of your vagina. So
You can handle an IV.
I was like,
literally.
I'm putting a 20 gauge in you. You're okay.
How do you take care of yourself emotionally when the outcome is not always positive?
I've had to learn how to do that.
Yeah.
So labor and delivery, sometimes they're not always alive when they're born. And I think those are the hard ones. I specifically remember I had a 34-weeker who she showed up to clinic and just said, oh, I haven't felt baby move since, yesterday, which already is a red flag. And the doctor did an ultrasound and there were no heart tones. So, and the baby had other medical complications. Like it was severely fetal growth restricted. It also had like reverse end diastolic flow, which is like basically like it's going to stop growing and the placenta's not doing what it's supposed to do. And it's just a whole thing. We call it an IUFD, or an intrauterine fetal demise. It was really scarring because the contractions got so bad that she needed an epidural. And I remember thinking to myself, like, I'm literally like sitting this patient up for an epidural and she's bending over and she's just like sobbing really quietly as she's getting this epidural. And I was like, oh my gosh, I'm literally doing this for a baby that's not even alive. And, she's going through this painful contractions and she's going through this painful, epidural. And it also took forever to get the epidural. And it was her first baby. And then she lays back down. Finally, she's not having any pain, with the contractions, but she was complete. And then I didn't know this, but you had to push like how you would normally push. And that was the worst. That was the worst because you could see this poor, little Hispanic mom who's alone in the room. And she's like trying to not cry as she's trying to push, but it was horrible. It was horrible.
Yeah, I could like cry right now. That's horrible.
I know, it was horrible. So when I went home that day, I did the sad girl thing where I got in the shower and just sobbed. I got in the shower and sobbed. But then also it makes it sound like I sob a lot. I really don't. I really
We're
don't.
always crying now.
No, I literally was talking with my friends yesterday and I was like, I haven't cried in a while. And literally I'm on this podcast and I'm like, I cry every day. No, so I remember I called work and I had said I would love to have like a good delivery the next day.
Yeah.
And I think me saying that was everything because I had to go back to work the next day. And when I went there, I had a great, phenomenal delivery. And not to say that that completely then negated the horrible day that I had yesterday, but having a good day afterwards and having a team make sure that you have a better day was amazing.
Yeah, absolutely.
And then like in terms of like things that I did for myself, I let myself process it for a bit. But I also didn't want to just sit and dwell in like the sadness of it. So I remember I got a workout in and I was like, don't think about the patient. Don't think about the patient's family. Just focus on this workout right now. And I did that. And then I focused on cooking dinner. And then I, was just focusing on like my day-to-day life. I still think of that delivery till this day, like in my head. I still remember her face and everything. It's just some of the stories that you get and the experiences you get from L&D, they just stick with you. And it's not so much that you don't ever get over them, because I don't think I ever will fully get over it. But I think it's just, it's an honor and a privilege to work the job that I do. And I think it's not necessarily a weight that I carry, but it's more of, I'm proud to do what I do. And all these stories kind of, build on top of each other to make me a better nurse and to make
Absolutely,
me
yeah.
more appreciative of the job and the field that I work in. So yeah, that's kind of like how I go about that.
That was beautiful.
Oh, yeah.
It was.
Oh,
It
yeah.
was.
Thank you.
Being a fairly new nurse, what is like the most challenging thing you've endured so far?
Ooh, okay. So being a new nurse as a whole thing, and then
Yeah.
being a new nurse in L&D is like an extra step. So I feel like being a new nurse, I guess I didn't realize how confident in your skills you have to be.
Oh, yeah.
And confidence is a big thing. And
Yeah, it is.
I am not when I was a nurse, I was not a confident individual. I was
Same.
like, oh, I don't know what I'm doing. I think as a new nurse, the biggest thing is you're learning so much at once. You're learning how to manage your coworkers. You're learning how to chart. You're learning how to do your skills properly. You're trying to learn the specialty that you're in already, which is a whole thing. You're also trying to manage your outside life because now all of a sudden you're not in school and you're only working 3 days a week. And so you have 4 days off and you're like, what do I do with my time? How do I meal prep? How do I,
Yeah.
what do I do? Specifically in L&D, I was very graciously given 16 weeks to orient. And what's crazy is that I don't even think that that was enough. Even with my crazy orientation that I had 3 weeks in the OR, I had a week in triage, and then I had 12 weeks on the board. And it was, even still, when I first got off orientation, I was like, what do I do? I was like, and it's crazy because my orientation was, oh my gosh, my preceptors watching this, Selena and Sabrina, they know exactly what. So I had 13 sections before I had my first vaginal delivery.
Wow.
Every delivery that I had was either emergent or something was happening that, like, very rare cases happen that I've never seen except since orientation. Even after those 12 weeks on the labor board, and the week in triage where you just basically stick a bunch of people, and I missed a bunch of IVs. And that was
We
great.
all do.
We all do. And then the 3 weeks in OR, I was like, I don't know, but I don't feel very good about this whole thing. But I will say, after, I want to say like my first like 3 to 6 months on my own, now I feel much more confident. And I feel like now I'm like, oh yeah, it's not a problem. Like now I stick everyone. I'm confident in my skills. Like I'm comfortable talking to doctors. That's another thing as a new grad.
Oh, yeah.
I was like, oh, help me. I'm like, and doctors are, colorful personalities sometimes.
I love how you say colorful. It's such a
They're
nice
just,
way.
little muffins every now and then. Also, working with residents, that's a whole thing that we should have a separate episode for that. Working with residents is a whole thing.
Yeah.
But no, I mean, really, like, there's a lot that goes on in a new grad's mind. And I'm so happy that I always tell all of my friends who are like finishing nursing school or they're just like about to start their new job is that you're not a new grad forever.
Yeah.
Time doesn't stop. So at some point you will not be a new grad and
Absolutely.
you never have to be a new grad again in your life. And that's the best feeling ever.
Do you ever look back and be like, oh my God, I can't believe I did that and like accomplished it? Like,
All the time.
I think about that all the time.
time,
I'm like,
yeah.
I cannot believe, because I started on a med surge floor.
Oh,
with like
cute.
6 patients, and
That's fun.
I cried a couple times.
Just a couple. Yeah.
A lot of silent drives home, and it was horrible. It was such a whirlwind of like knowledge and just so much to learn at once. And I look back and I'm like, I did that.
Yeah, you did it.
I did that.
Yes, you did. And you know what? I always tell myself when I go into work, I tell myself this, and I advise this to all new grads, is I want you to go in every day and find one thing that works out for you or one thing that you did that you're like, yes, like
Absolutely.
under your breath. Like,
Yeah.
just anything. It could literally be like an L&D putting your baby on the monitor for the first time without like putting a bunch of jelly and like trying to find the baby. Like you just, put it on the monitor, bam, heart tones, getting your IV. Getting your patient over, getting her delivered, like simple things like that, that I think they'll just make your day better, and it'll make coming into work a little bit more like a game where it's like, okay, what's the one thing that I can do today that I'm like, I did that.
Yeah.
And one of the other things I even realized now, because I've been in L&D, like it will be a year and a half, is I'm still learning things, and I'm always learning things. And I think now I'm more humble than I used to be about asking questions. Because I think when I first started, I was like, I mean, I know I can ask questions, but I don't want to be a burden to people. So I don't want to have to ask a million questions to people all the time.
Absolutely.
But
Yeah.
when you know how to do things and you ask questions, it's like, it's such a it's such a good feeling to have. Because it's like, okay, so they know I'm not an idiot. But
But I think that's a good thing because I know things all the time and I'll ask because I'm like, well, I've never done it before, but I know.
Mm-hmm.
And then I'm just bouncing this idea off of you. And I think that's a good sign that it's like, this is a life. I'm doing something to someone that's invasive.
Yes.
And I'm taking an
Yes.
extra moment to just verify that what I have in my brain is correct. I think that's a good sign that you're like asking questions because I feel some people would be too scared or nervous or like be scared of judgment or whatever. And they wouldn't ask. So it's
Yeah. And I think that also in L&D specifically, I'm pretty sure it's the same in NICU, but there are certain like high risk case by case things that you don't get so often.
I think another benefit to asking questions a lot is sometimes you realize that not everyone knows. Like I'll go up to like a seasoned 15-year nurse and I'm like, I come up with this crazy question and they're like, I don't know. Let's look it up. And I'm like,
that's the best feeling
I'm not
ever.
dumb. Yay.
No, it's like, oh my goodness, so I'm not crazy. I think especially when you're newer in the field, and especially I'm really young in my field, and
Absolutely,
a lot of the nurses that I work with are not my age at all or close to my age. There's a couple that are like close to my age, but many of them are not, and they've been doing L&D forever and ever. So it just feels very not rewarding. That's the wrong word, but it feels good when you're like, look at all these senior nurses and they're still asking questions and they still don't know things. It's like, okay, so it kind of is like, to me, I'm like, well, I'm never going to, know everything. And that's the great thing. And it's a never ending field of learning. And that's the best feeling ever because I love to learn for the sake of learning. So it's like, okay, this will be good now. This will be great. Like, I never have to be like, well, I know everything. Because I never will. And
there are some people like that, and it's like, I don't want to work with you.
Oh, yeah, no, girl, tell me about it.
Okay, so do you have any other L&D stories you'd like to share before we move on to...
Orientation. 2 cord prolapses happened at the same time.
What?
Oh, my God. I don't know how that happened. And you know what's crazy is I've never had a cord prolapse since. So I'm taking care with my preceptor. We're taking care of patient 3. This other nurse has the patient in room 1 and 2. Room 1 is asking for an epidural, which is a 1-to-1 thing. So she's like, hey, I'm going to do an epidural in room 1. Can you watch my room 2? And I was like, yeah, sure. We'll watch your room 2. Like, that's fine.
Yeah, God.
So she goes, no, literally. So she goes into room 1 and she's doing this whole epidural, right? My preceptor and I have the 2 monitor strips pulled up on our computer. And we notice in room 2, the baby's acting up. Not terribly or anything, but it's like, we call it variable decelerations. So it's usually linked to umbilical cord compression. So it's really easy. If they're laying on their right side and their cord is compressed, you just flip them to the left side and then they're not on the cord anymore. And there you go. Problem solved usually. Like, positioning is usually key. So my preceptor's like, I'm just going to go and flip room 2 really quickly. Like, you just stay and just keep an eye on them. And I was like, okay, great. No problem. I hear on the Vocera overhead, cord prolapse, room 2. And I see my preceptor, and we call it riding the bed. So she literally has her hand all the way up to push on the baby's head to alleviate tension between the head, the cord, and the cervix, basically.
Yeah.
Because if it compresses fully, the baby doesn't get blood flow and can't breathe. So she's literally, I've seen them wheeling out this bed, and she's on the bed. Turned out her water broke and she literally lifted up the blanket and it's just all out, like the whole thing. And she's like, just watch room 3. Like, room 3 is going to be okay. Like, don't worry about it. Like, I'll meet you in there. And I was like, okay. So I'm alone, right? Orientee, week 3 of orientation, or I don't know what week it was. And now all of a sudden, of course, my girl starts tanking in room 3. And literally you just see the heart rate and it just goes, "Eep." And I just get up, walk in the room, and I, naively, I'm calling the provider, and I'm like, "Hey, I'm having like the baby's heart rate's really low." I didn't even say like a prolonged decel. I was like, "The baby's heart rate's really low." Thank God I had a midwife who was like understood the urgency. So she comes in and she checks her and she goes, "Unlock the bed. We have a cord prolapse." And I was like, "Great." So now, thank God there were other nurses with me. So they call a cord prolapse. And I'm like wheeling this bed into the other OR. My preceptor calls me as we're running and she goes, "What happened?" I was like, "I don't know. I ran in the room," whatever. And of course, I know nothing in the OR. I've had no OR orientation and I'm the primary nurse. So everyone's asking questions. They're just like, "Have you like, when did this happen? What time did her water break?" I'm like, "I don't know anything at all. Like, the cord's out." And the midwife is like, "Just start, like, just do it." The baby came out fine. Like, the baby came out screaming. But no, after that like scarred me. And I remember specifically the safety nurse, which is like a high elite L&D nurse that like we like worship by. She goes, "I don't think we've ever had two happen back to back." I was like, "I think I broke both of them." And that was the theme, is that I've been breaking patients on orientation all the time because it's happened a lot. One that I had that I've happened a couple of times actually is called a shoulder, like a shoulder dystocia. Basically the head comes out. The top part of the shoulder is like stuck basically. So you overhead for it. So thank God my first one was an orientation, but I ended up having a shoulder like 2 weeks ago, and I was so proud of myself because I recognized it and was like, "Do you want me to call it?" And she goes, "Yeah, you can call it." Jumped up on the bed, did the McRoberts maneuver, and I ended up having to do super pubic, and I did it, and the baby just like flew out.
Yay!
And I'm so proud of myself because the first time I had a shoulder, I literally just stood back and I was like, "I don't know anything." And now I'm the person who's like jumping on the bed. And I was like,
that.
I'm proud of myself for doing that.
Yeah.
But no, there's a lot of emergencies that happen in OB, but I also like, I think it's just with me. I think I have a magnet attached to me or something. So,
Your little cloud over you.
I do.
On that day home, did you like jam out to some music?
Yeah,
I was like, "I am the best."
Did that. I was like, and what was crazy is that the patient went, "You're a badass." I was like,
I am.
"Oh, just like, you want my autograph?" Sure. Like, I just got your baby out.
I think you kind of vaguely touched this, but looking ahead, what kind of nursing do you want to focus on?
I love L&D so much. And I think the type of nursing that I want to do to continue like my love for it is to be a midwife, like a certified nurse midwife. Which is essentially to just be a provider for obstetrical women and to do prenatal care. And I think that that's something that I haven't done yet, but I would love to do. It's kind of participate in prenatal care with patients.
Yeah.
And, have those moments with them. And I don't know, it just seems really like I'd love to do it. And it's great because I get to be the one who's catching the babies. And, like when you're a provider and you're giving the order, not that I'm like excited to be like giving orders, but, I kind of want to grow in a role where it's like I would like to have some sort of say in things. I have been a leader for a while, and this is the first time in nursing where it's like I'm not a leader and I don't want to be. But I think now recently that I sort of kind of know what I'm doing, it's like I kind of want to see if I can become a leader. And I think being a provider is a great way to do that.
Do you have any plans to actually start school soon?
I have applied. I have not been accepted yet. I don't know. I'll keep everyone posted on that. But yeah, we'll see.
What does the process look like for becoming a midwife?
So oh my goodness, this sounds like my parents are asking me, like, how do you do it? It's like, it's so challenging sometimes. So every school literally has a different length, different way of doing the program. The most simple way that I can put it is that if you're full-time, it usually takes about 2-ish years, 2.5 years. If you're part-time, it's like 3 to 3.5. Some programs are fully online, some are fully in person. But the general consensus is that you do the same courses that pretty much everyone does when they get a master's degree in nursing. Then you specialize in women's care, and then you do clinicals. So then you go and you deliver a certain number of babies. So yeah, I hope hopefully it'll be good. Hopefully I get in, and then hopefully I'll do it. So that's the goal.
My fingers are crossed for you.
Thank you.
You'll definitely get in. If you could go back in time and give your baby nurse self a piece of advice, what would it be?
Pull yourself together, you'll be okay. That would honestly be my best advice is learn to be okay with not being okay at what you're doing. And that's fine. Like, it's the first time that you don't know what you're doing. I've always been like in like middle school, high school, college. Like I'd always been someone who's very successful and someone who's like very high achieving, someone who like, you know, I had a 4.0 in high school. In college, I graduated like magna cum laude. I was like well received in college and, you know, and in high school. And there was just a lot, like I was like leaders and chairs for like lots of things. And then so when I started working, it was the first time that I was at the complete bottom of the totem pole. And I think I used to obsess over the idea of what's the quickest way I can go up. And then instead now I think I would just tell myself, just enjoy it. Like,
absolutely. Yeah.
And just learn to be okay with whatever pace you're going to go at. And then have fun. I used to be so stressed going into work.
Same.
And now, oh my God, I used to be so terrified. And now I'm like, I get to just hang out with my friends and deliver babies. Like, it's kind of a cool job to have where it's like you get to hang out with your friends and just deliver babies. Like, sure, I'll do that any day. Yeah.
I know. Sometimes if I get stressed with work, I'm like, I get to go take care of babies. Like, life is good. I'm good.
Yeah. I don't have to sit behind a desk and do a 9 to 5 and, you know, get yelled at by a manager and talk to like 3 supervisors about some sort of meeting and table that I have to sit. No. I'm so happy that we do what we do.
Absolutely.
Yeah.
If someone were to come to you and say, I'm really thinking about becoming a nurse, what would you say?
You're going to love it and you're going to hate it.
Yeah.
It's a love-hate relationship.
Yeah.
I think the best way to describe it is that I'm very proud to be a nurse, but I would never, oh my God, in public, no. If someone has fainted on the floor in the airport, I'm not the person you want there. My guess is as good as yours. Now, if someone's ready to have a baby on a plane, I am your man. Like, I'll do it. You put what you get out of it, what you put into it. And I think if you're someone who is a go-getter and loves to be with people and loves to help because you're a good person, not because of like, you know, any other reason, you will fly no matter what.
Yes.
I think nursing for some people has been more of a trendy thing. And I think those people don't usually last that long. But if you really care about people and you really can put yourself in their shoes sometimes, and you love to educate and you love to just be social with your patients, and you want to have a really cool job, then it's the best of both worlds. Like, it really is.
Yeah.
I loved science and I loved hanging out with people. And so it literally was just like the perfect realm. And I love what I do now. Had I stuck with pre-med, I don't think I would have stuck with medical school, honestly.
Wow. Yeah.
Yeah. Because I think I would have been like, well, the nurses get to hang out with the patients all the time. I don't ever get to. Not that they don't ever hang out with patients, but they hang out with them significantly less.
Yeah, they're like there for 5 minutes and then they leave.
Basically.
Well,
yeah.
At least what I do, yeah.
Oh, yeah. Yeah.
Probably in labor and delivery, they're there for a little longer.
For aspects of it, yeah.
Yeah. I think it is, if you're good with people and you like medical, like really interesting sciencey stuff, it's perfect.
Yeah.
Just like you said. Yeah.
If you like to know a lot about really niche things, that's another thing.
Oh, yeah.
Is I think. If you like, I don't know, problem solving and like, I don't know, like I was addicted to puzzles when I was younger, like putting all the pieces together and being able to be like, oh, this is what it is. Like, it's great.
I love a puzzle.
It's great. Oh, who doesn't love a puzzle? I don't know anyone who said I hate puzzles. Like, I mean,
I know people do not like puzzles.
Someone will comment that they hate
Yeah.
puzzles, but it's okay.
Thank you so much for coming.
Thank you. Thank you so much for having me. This has been fun.
Bye, guys. Thank you so much for watching.
Yeah, and please like and subscribe.
Yeah.
Support
Hello.
the channel, everyone. It's great.
Bye.
Bye.